guess my story begins a few years ago, back in 2002 in January, and I developed some pain. I noticed in my stomach one day, and I was out doing my little morning run on a Sunday morning, and I got back in. I thought, well, something didn't feel quite right, and I didn't think anything about it. And didn't have health insurance at that time, and still don't today. But and I'm a guy, and I just kind of thought, well, it'll go away. A few days later, it was still there, and a week later, it was still there, and a month later, it was still there. And my sister, who happens to work for a doctor, she said she'd seen me a couple of times, and she said, "You don't look well. What's wrong?" I said, "Well, I've had this pain." And of course, I'm a guy. I hadn't actually been going to the bathroom very well for a month at this time. And so my brother-in-law and her were over one day, and it was on a Sunday afternoon at my house, and I live in England. And she said, "Please let us take you to the emergency room. Something is going on." And I said, "No." I said, "I think it's going to be okay. Let me just." And so my brother-in-law was off. He said, "You call me tomorrow." He said, and I said, "I'll think about it. If I'm not better in the morning, I'll call Robert and I'll go to the hospital." Well, the next morning I woke up. I had the most miserable night of my life. Did not sleep at all. I called him like at 6 o'clock the next morning. He said, "Are you ready to go to the emergency room?" I said, "Yeah." I couldn't even drive myself. He came from Cabot to England to get me and took me up to UAM. And it turned out I had a diverticulitis, and it took them all day long to figure out my white blood cell count was through the roof. And when they finally did a CAT scan of the whole body, they found this big diverticulitis way down low here, and they said, "We've got to do surgery immediately." And of course, I was just freaking out. I had no insurance, and had never been in the hospital, never had surgery, and they were talking about colonoscopies and all this kind of stuff, and so I was just, well, I knew I had no choice. I had to do something, and they put me in the hospital that night. And the next morning, I went in, and I got to say, the doctors over there did a fantastic job. The surgeon, they were able to go in with a laparoscope, and he removed the infection, and it healed up. I spent a few days in the hospital and got out. And of course, I had no insurance. Well, the bills came in, and it was like over $15,000 just for the hospital bill, plus the surgeons and all of that. And at that time, I had had a real severe downturn of fortune in the couple of years preceding that, and I was working for a $10 an hour job, and I was actually in Chapter 13 bankruptcy for about a year and a half. I'd been in Chapter 13 trying to repay some debt, IRS and such as that. And so I went to the hospital, and I said, "I can't afford to pay this, what can we do?" And we tried to Medicaid spin down. They said it's a thing you can do, and when at $10 an hour, I made too much money to qualify for that, to pay this $18,000 in bills, a little over with the doctor bills and all of that. And I said, I was paying over $525 a month in child support. I said, I'm making $10 an hour, I'm paying $525 a month in child support. I said, I can't. Medicaid spin down didn't come around, so I said, well, I'll just have to make payments. I said, I'll pay it $100 a month. I said, I can do that. And before even 30 days, I started getting calls from collection agencies. And it was like all of a sudden they were like, "Where do you work? We're going to garnish your wages." And I didn't know what to do, so I called my bankruptcy attorney, and I said, "Robert," I said, "what can I do? These people are hounding me." And he said, "Well, no." He said, "You're under Chapter 13. I didn't know this. If you're ever in this situation, any necessary medical expense while you're under bankruptcy automatically can be put underneath that bankruptcy." So I was willing to pay them back every penny that I owed them. It would have taken me a while to do it. I'd probably still be paying on it today, perhaps. But they wouldn't even, once they turned it over to the collection agency, it was like there was no going back on it. So I ended up, the bankruptcy took care of it. That got paid off. Today, my fortunes have turned around. I have my own business today and doing quite well, but I still can't afford health insurance for myself. I have an employee, a young lady, 21 years old, and she lives with her boyfriend. He has insurance through his job, but of course they're not married, so she can't get on his plan. I can't afford to have insurance for her. So I eat right, I take good care of myself. I have a great chiropractor who takes good care of me, and I just knock on wood and pray to God that I'll stay healthy. And I hope that, that everyone, we can all stand together. It really is time for this to happen. I know it scares a lot of people, the thought of this providing health coverage for all of us, but it is time for it to happen. And we've got to just work against it. I believe there's a lot of greed in the healthcare field with these pharmaceutical companies and hospitals and surgery centers, and I'm not sure who all is involved in it, but the insurance companies for sure. So I hope we can all just kind of stand up and support our neighbors and support one another and support President Obama in getting this passed and getting